There we go. Thank you.
You rocks.
Thanks. So again, good evening, everyone. So today's presentation, we're going to have a look at the phases of treatment. For some of you that are on this platform, you might be quite au fait with treatment terms, recovery terminology, etc. But for some of you, it might be quite a strange concept. So there, as you can see in the objective, we want to have a look at some of these stages of treatment or these phases of treatment, what that looks like, and then also try and apply it to the changes system. So just the first point there, individuals struggling with addiction often benefit from a continuum of care with the gradual stages of structure and with support. So keeping that in mind, we're going to have a closer look at addiction and the impact of addiction and how that relates to treatment. We're also going to reflect on the principles of effective treatment. So what does effective treatment look like? What does that mean? We're also going to consider the importance of continued treatment, and that's going to be quite a large focus of our presentation today. And then we're going to take all of the above and we're going to apply these principles on treatment at Changes by looking at the different phases of treatment and what that entails at Changes. Right, we can go to the next slide, please. Right, so some of you have been to quite a few of these presentations and have heard addiction being described in different ways. So for the purpose of today, we're going to look at how it relates to treatment and the importance of addressing these different factors within the treatment sphere. So drug addiction is a complex illness that is characterized by intense and at times uncontrollable drug cravings, along with compulsive drug seeking, where use persists even in the face of devastating consequences. So one of the ways that I like to just define addiction very loosely is that in spite of the adverse consequences, we do it anyway. And for me, that really quite sums it up. So the drug-seeking behaviors, the dangers surrounding that, the consequences of our using, in spite of all of that, we still continue with the usage. So nearly all addicted individuals believe at the outset that they can stop using drugs on their own, and most try to stop without treatment. Although some people are successful, many attempts result in failure to achieve long-term abstinence. Research has also shown that long-term drug abuse results in changes in the brain that affect multiple brain circuits, including those involved in reward and motivation, learning and memory, and inhibitory control over behaviors. That is what we often refer to addiction as being a brain disease. While a person initially chooses to take drugs, over time the effects of prolonged exposure on brain functioning compromises that ability to choose, and seeking and consuming the drug becomes compulsive. Next slide. But apart from this, addiction is also more than just compulsive drug taking. It can also produce far-reaching consequences. And I'm sure for many of you on this platform, you are very familiar with some of those consequences. The dysfunctional behaviors that are associated with drug abuse can interfere with a person's normal functioning in the family, the workplace, and in the broader community. Because drug abuse and addiction have so many dimensions and disrupt so many aspects of an individual's life, treatment is complex and it takes time. Effective treatment programs typically incorporate many components, each directed to a particular aspect of the illness and its consequences.
Yeah.
Therefore, addiction treatment must help the individual stop using drugs. We need to help them to maintain a drug-free lifestyle and achieve productive functioning in the family, at work, and in society. So again, it's all these different factors that we need to take into consideration. There's all these different areas of a person's life that get impacted through addiction, and all of those need to try and be addressed within the treatment process. Because addiction is a disease, most people can't simply stop using drugs for a few days and then be cured. Patients typically require long-term or repeated episodes of care to achieve the ultimate goal of sustained abstinence and recovery. So just in terms of the sustained abstinence and recovery, there's a term that or something that we try and teach the patients and something that you might have heard on this format too. But we say there's a big difference between being clean and being in recovery or having sobriety. So being clean is simply abstaining. So not taking the drugs, not drinking, etc. Where being in recovery and sobriety, it's about a lifestyle change that needs to take place. So putting down the drugs or putting down the substances, that's but a very, very small part of the process. There's moving from that side and that lifestyle to like almost literally changing every single thing about your life. Again, the way that you socially interact, work, your language, the way you dress, that there's a whole culture that comes with the addiction. So there's a lot of that needs to be looked at. So it's quite a complex thing. It's not just about putting the substance down. So in light of this definition of addiction or what addiction is, I just want to have a look at some of the principles of what effective treatment is. So what is required for your loved one to come into treatment and for them to have a fighting chance at their recovery? So the first point there is that addiction is a complex but treatable disease that affects brain function and behavior. Okay, so we discussed that in the definition as well. So drugs of abuse alter the brain structure and the function, resulting in changes that persist long after drug use has ceased. So those changes that have taken place because of the chemical use, they don't just simply get restored just because, again, one has put the substances down. That takes some time. This may explain why drug abusers are at risk for relapse, even after long periods of abstinence, and despite the potentially devastating consequences. The second one is that treatment needs to be readily available. Because drug-addicted individuals may be uncertain about entering treatment, taking advantage of available services the moment people are ready for treatment is critical. Potential patients can be lost if treatment is not immediately available or readily accessible. So the way that I like to explain it is that one needs to strike when the iron is hot. When your loved one has come to you and they're starting to discuss the problem, or when when there's a crisis, that's a great time to initiate treatment. And then something we're going to look at a little bit today as well is extended treatment and what that might look like. And while your loved one is in treatment and busy receiving treatment and going through a process, it's also a really good idea at that point in time to discuss possible options of continuing with treatment. So the third point there is remaining in treatment for an adequate period of time is critical. And again, this is something that's going to come up quite a bit today. And just because, it's something that I feel is really, really important. So the appropriate duration for an individual depends on the type and degree of the patient's problems and needs. Research indicates that most addicted individuals need at least 3 months in treatment to significantly reduce or stop their drug use, and that the best outcomes occur with longer durations of treatment. Recovery from addiction is a long-term process. So research has also shown that the longer an individual is in treatment, the better the success rate or the better their chances at recovery and long-term abstinence is. And some research has also even shown that, and you'll hear we often speak about this 3-month mark or the 90-day mark. It will come up quite a few times. But some research has even shown that for individuals that have had treatment for less than 90 days, that in some cases, their success is almost the same as somebody that's only been in treatment for 1 or 2 days. So this 90-day mark is quite significant, and it shows that once a person has received treatment for up to 90 days, that their chances increase quite dramatically at getting this right. So yeah, the period of time is a really critical point. Number 4, effective treatment attends to the multiple needs of the individual, not just his or her drug abuse. Again, it's not just about putting the substances down, but there's so many different areas that need to be addressed in treatment, and that's also why we often require time. To be effective, treatment must address the individual's drug abuse and any associated medical, psychological, social, vocational, and legal problems. Thank you, Colvin. Speaking just for 2 seconds. Right. Number 5, an individual's treatment plan must be assessed continually and modified as necessary to ensure that it meets his or her changing needs. A patient may require varying combinations of services and treatment components during the course of their treatment and recovery. In addition to counseling or psychotherapy, a patient may require medication, medical services, family therapy, parenting instruction, vocational rehabilitation, and all social and legal services. For many patients, a continuing care approach provides the best results, with the treatment intensity varying according to a person's changing needs. So again, it just speaks about all those different things that need to be addressed during treatment. And again, when one thinks about it that way, it makes more sense as to why one might need or require more time for treatment and for treatment to be effective. Number 6, many drug-addicted individuals also have other mental disorders. So, because drug abuse and addiction, both of which are mental disorders, often occur with other mental illnesses, patients presenting with one condition should be assessed for the other or others. And when these problems do co-occur, treatment should address both or all, including the use of medication as appropriate. Okay, so we often refer to this as being a coexisting or comorbid disorder. So it just means that along with the substance addiction, there is also a different diagnosis, which can be depression, bipolar, schizophrenia. There's a variety of those, but that also needs to be taken into consideration. So when it comes to the medication, that's a psychiatric element that needs to be addressed. And although our predominant focus is on the addiction and the treatment of the addiction, we can't ignore the other conditions that exist, and they need to be under management too. Number 7, treatment does not need to be voluntary to be effective. And I think this is often one of the mistaken beliefs. So boundaries or enticements from family, employment settings, and or the criminal justice system can significantly increase treatment entry, retention rates, and the ultimate success of drug treatment interventions. So it's a lot easier for us when our loved one agrees to treatment and agrees to coming into treatment. It's also a lot easier for us if our loved one agrees to extended treatment. But this isn't just their choice. I do believe as family members and those who have also been impacted and affected by their addiction, your voice holds value too. So I think it's quite important to set boundaries. So if it's something that's important for you and you want them to continue, you're welcome to do that. And what are your bottom lines? What are you willing to continue doing or not continue doing if they're not agreeing to the treatment recommendations or agreeing to what you feel is in their best interest? Right. So keeping all of this in mind, all of these factors that contribute to effective treatment, I want us to have a look at what treatment at Changes looks like. And we're very cognizant of the fact that loved one has come into treatment and they are in a 24-hour therapeutic environment, and there's a lot of jargon that they get used to, and you might be exposed to some of that, but you don't really understand how everything fits together. So I'm hoping that during this presentation, we can give you an idea of how all those puzzle pieces fit together, what the treatment is looking like for your loved one in the phase that they're currently in, but also what other phases there are in the Changes system that your loved one could possibly benefit from. So Changes offers the full spectrum of addiction treatment to a multitude of patients in various phases of treatment. This is done through high quality, specialized clinical family support and reintegration services. Treatment is personalized to each patient, and individual treatment plans are developed for each client's specific and unique needs. So when we start looking at these different phases of treatment, it's not a cookie cutting process. So what is going to be really important for one person isn't necessarily going to be the same for a different patient. So people's paths at Changes can look very, very different. So, and that's why it's so important for us as a multidisciplinary team. We meet twice a week where patients get discussed, their cases get discussed, recommendations get made in terms of treatment, etc. So we offer primary, secondary, and tertiary care or rehab treatment programs, as well as relapse prevention care. Our addiction treatment centers have created the best addiction rehabilitation programs that are aimed at achieving lasting recovery and sobriety. So there's just a quick snapshot of what these different phases look like, and we're going to unpack them in a lot more detail. So the first one is primary care, which I'm sure most of you are familiar with. That is often where patients do start in our process. Not all the time, and I'll explain later where they can also come in, but quite often the primary care is the first point of contact and the first phase of treatment for many patients. So primary care, our facility is in Northcliffe in Johannesburg, and the length of stay there is usually 21 to 24 days. The following phase of treatment, if that is recommended and if one decides to go that route, is secondary care, where the minimum requirement is 2 months. So first off, you can see that primary care, which is 21 to 24 days plus the 2 months, takes us a lot closer to that ideal of 90 days, which is why the recommendation is a minimum of 2 months. However, that treatment can go up to 9 months within the secondary care. But again, that is very individualized and is patient dependent. Our secondary care treatment facility is in Reimsig in Joburg, and it offers high quality care to allow people to get past that initial critical 90-day mark, to get them clean and sober in a tranquil therapeutic environment. So our secondary care treatments, not very clinical, it's very homely, which also helps for that extended period of stay. Often then people would go to halfway house. In some instances, people will jump from primary care to halfway house as well, again, dependent from person to person. The stay there is unspecified. So that can be anything from 1 month to even exceeding a year. So that's just a transitional living home for people committed to living a sober lifestyle and needing support during the phase where they reintegrate. Then we have three settings that are not residential based. With other words, it doesn't require that one stays in treatment with us or in a sleeps over in one of our facilities. It's something that they can do while they're at home. They can also do it while they are still in halfway house, but that is not a prerequisite. So those 3 phases are outpatient, aftercare, and living recovery. And for now, I'm not going to unpack them too much because I want to spend quite a bit more time on them a little bit later on during the presentation. Right, so the first one is primary care, which we've already spoken about, but I'm quickly just going to go through what that does entail. Right, so primary care is offered on an inpatient basis. So that's just what I was trying to explain. So inpatient means that they reside with us, they stay here, they sleep here. This is the most intensive phase of treatment. A way that I like to explain it is this is almost like the ICU of treatment. So yeah, it's quite critical. There's a lot that needs to be done during this phase of treatment. The objective is to narrow the discrepancy between the patient's flawed perspective of their addiction and the reality of what it's actually like for them and their loved ones. It's only when the patient has an acute awareness of the severity of the addiction that they will be able to take responsibility for their recovery. So just to put that a lot simpler, it's about breaking down that denial. When addicts often come in, they are not being completely honest with themselves, with others, about the severity of their addiction. And there's a level of denial required in order for one to continue using. So this phase of treatment is really about starting to talk about those consequences, starting to bring the reality home of how severe the addiction is and the ripple effect that has had. So once the patient's withdrawal has been medically managed and detox is complete, and we'll touch on what detox is now, the focus is on dismantling the denial, which is what we've just spoken about. So just for those of us that aren't aware of what detox entails, detox is just done by our experienced medical team that manages the detox process. The aim of detox is to safely remove substances like alcohol and drugs from the body while managing the withdrawal symptoms. Okay, so treatment includes, I've listed a few things there, but it includes so much more than just that. But individual counseling or therapy, 12-step treatment, group therapy, didactic training, occupational therapy. We have consulting psychiatrists that also then help with the management of the comorbidity. During primary care, patients are equipped with knowledge about their disease. So there's a lot of psychoeducation done around what is addiction, that it is a disease, and the impacts that it has on us, and a multitude of tools that they can use to avoid relapse and to stay clean and sober. So during any phase of treatment, relapse prevention is one of the major focuses of treatment too, right? We don't just want to come in here and clean up and go out there and not have tools to try and prevent relapse from occurring. So relapse prevention is one of the main during all phases of treatment. Each patient's therapy is individualized through a professional team's ongoing assessment in conjunction with the patient and the family input. So during primary care, there are regular phone calls that take place to the family members to keep them in the loop of where the patient is at, the progress that's being made. There's also 2 conjoints that take place. So again, the family's input is of absolute value to that therapeutic process and their involvement. The more family members can work with the therapeutic team, the more beneficial it's going to be for your loved one. Recovery is a lifelong process that doesn't end when the patient walks out the door. While in primary care, the therapeutic team help the patient make a custom plan for aftercare, which could include secondary care, transitional housing, outpatient treatment, meetings or a support group, and continued therapy. So again, quite often we can almost get a pretty good idea within the first week whether or not somebody's going to need extended treatment. And sometimes those discussions will start taking place at that point in time. Sometimes things come to light as the person progresses, and then recommendations can be made in terms of continuum of care and what that could possibly look like in the changes system. So does that mean that they need to have secondary care? Does that mean they need to be in a safe environment like a halfway house while transitioning? Or does that simply mean that they can join the outpatient aftercare or living recovery programs? So that is assessed again from individual to individual, and those recommendations will be made to the loved ones, to you as family. Thank you, Calvin. Okay, so long-term treatment. There is no one-size-fits-all approach to recovery. Treatment programs vary in terms of setting, duration, and intensity, depending on the individual needs of the patient. For some, this might include long-term treatment. So again, it might include it for some people, but that 90-day period is absolutely critical when it comes to recovery treatment. So short-term residential treatment generally consists of 3 to 6 week inpatient treatment, similar to that of Changes primary care treatment. Ideally, short-term rehab programs are followed by extended outpatient care or long-term residential care. Again, the residential care means being with us, staying with us, and sleeping in a facility with us. This is because recovery takes time, and even several weeks of treatment is often not sufficient for overcoming addiction. Long-term drug rehab usually involves at least 90 days in a residential treatment setting, at minimum. Some rehab programs require or even encourage longer durations of stay. Long-term addiction treatment refers to a comprehensive approach, providing individuals with an extended period of support and care. Unlike shorter rehabilitation programs, long-term treatment offers a more gradual and sustainable path to recovery. Research indicates that most addicted individuals need at least 3 months, there it is again, that 3 months, 90 days in treatment, to significantly reduce or stop their drug use, and that the best outcomes occur with longer durations of treatment. The longer a person stays in treatment, the more likely they are to benefit. Can go to the next slide. Did we skip one, Calvin, or are we right? I think we're right. We were right. Sorry about that. Thanks. Okay, so what is long-term treatment again? At Changes Addiction Rehab, we have seen similar results within our treatment community. Again, just referring to the longer a person stays in treatment, the better their chances are. And if one can get past those 90 days, their chance of success improves dramatically. Treatment needs vary from person to person, but factors that might influence the length of treatment include the severity of one's addiction, the length of a person's addiction, previous treatment attempts, history of relapse, co-occurring substance and mental health disorders, as well as individual progress and how your loved one responds to treatment. Calvin, we can skip. Okay. So as you can hear, there's a lot of talk about the longer treatment is, the more beneficial it is. And this is why I want to just have a look at what are the benefits of long-term treatment. One is an increased chance of lasting abstinence. So scientific evidence shows that the longer the treatment, the better the chance of lasting sobriety. Addiction is a complex but treatable disease that changes brain structure and function. These changes last long after drug abuse has stopped. This is one of the reasons why staying in treatment for a long enough period is important, and this might also partly explain why relapse rates drop significantly after 90 days, and then again after 1 year. Research has shown that anything less than 90 days in treatment tends to increase the chances of relapse. Okay, so again, just the longer you have, the better chances you have. It gives you the time you need to reverse the impact of addiction, or it gives one the time to reverse the impact of addiction. Just as it takes time to develop an addiction, it takes time to address the effects of addiction and develop habits that promote recovery. Addiction involves complex changes in the brain structure and chemical functions that occur over time. They affect thought and behavioral patterns that often result in self-destructive behaviors. Long-term treatment provides extended time for the brain and the body to normalize, so that when a person is ready to leave treatment, they are less likely to fall victim to drug cravings or co-occurring mood disorders related to these brain changes. This time also helps solidify recovery and allows an individual to make lasting habits out of the coping skills and the routines they have established during treatment. So on the one hand, and I think we'll touch on it a little bit later, but they get taught quite a lot of skills, and that's stress management, coping, relapse prevention, effective communication, etc. That's just a few. But while they're in treatment, and if they have that extended time in treatment, they also have time to start practicing those and start applying a lot of those skills that they have learned. Thank you, Colin. So number 3 is that it promotes healthy lifestyle changes. Long-term residential rehab encourages, guides, and assists individuals as they make healthy lifestyle changes and develop healthier habits like exercising, journaling, meal planning, and other daily methods of self-care. Spending several months developing and practicing new habits in a structured, routine-orientated environment helps to ensure the change an individual makes will stick once their time to leave treatment arrives. Number 4, it fosters close, healthy relationship with peers in recovery. So peer support is important in treatment and in recovery. People who have never been addicted can't fully understand what someone in recovery is experiencing, and they may be unsure how to support a friend or a loved one. The shared experiences of addiction, however tragic, can create a bond of camaraderie and commiseration among those that are in recovery. Through group therapy, workshops, social events, and recreation, peers in recovery help each other stay motivated, accountable, and honest. Long-term rehab promotes the development of strong, healthy relationships that form over an extended period of time. These relationships are often very valuable once treatment ends. So when it comes to recovery treatment and relapse prevention, we often teach people about people, places, and things. Excuse me. And one of the things that they would need to stay away from is old friends. So developing new relationships can be very, very beneficial in treatment. Please excuse me for 2 seconds. I just need to top up my water bottle. I'm really sorry about that. Number 5, keeps out distractions. For many, trying to recover while living at home poses several serious challenges. Trying to recover while trying to cope with the stresses of work and home, in addition to struggling with cravings and negative emotions, is hard and therefore often unsuccessful. The many benefits of long-term rehab include the ability to focus just on recovery without outside distractions, temptations, or stress getting in the way of the progress. So sometimes just having this time to focus on one's healing, focus on one's recovery, focus on getting better, and then get to a place where you're ready to tackle life on life's terms. Number 6, it offers a high level of support. Support is one of the foundations of successful recovery. A high level of support is crucial in the early months of recovery, and long-term rehab provides sturdy support while in treatment and beyond. Support comes from staff and peers in recovery, and it's available around the clock. Working through the complexities of addiction takes time, and being able to reach out for help whenever it is needed in the early months of recovery is a major benefit of long-term rehab. So there's a lot that one goes through, there's a lot that comes up, especially in the early days of recovery. And again, to a certain extent, one can speak to your family and your loved ones, but there's a lot that one might not understand and might not be able to relate to, or you might not know how to help or to support. So being in a safe environment where there are people that know and people who are able to relate is really beneficial. Recovery is not a linear process. There are many ups and downs. Patients get to experience these ups and downs in a safe environment while learning new coping mechanisms and applying them in said environment. Thank you, Calvin. Number 7, the family, which is you, has time to heal and work on themselves. So we often say that addiction is a family disease. One person may use, but the whole family suffers. Addiction often strains relationships, and repairing them is a gradual process. Long-term treatment offers the time needed to mend relationships and rebuild trust with family, friends, and loved ones. Number 8, an essential part of long-term addiction treatment is the cultivation of a life rich in purpose and fulfillment. Substance abuse often hijacks a person's ability to find joy in everyday activities, replacing genuine passions with an unrelenting pursuit for the next fix. Okay, so I'm sure that's something that many of you have seen. So how your loved one has lost interest in things that they really enjoyed in the past, hobbies, interest, all of those just kind of dwindle as life just becomes about using and getting that next high. So long-term treatment also counteracts this by fostering engagement in positive, life-affirming activities. Number 9, it allows for a deeper understanding of one's addiction. So as individuals progress through long-term treatment, they gain insight into the patterns of behavior that contribute to their addiction. Addiction is a behavioral disorder. The behavior needs to be identified and addressed, and new behavior needs to be established. So again, when that's done in a safe environment, when it's done in an environment where they are monitored over a long period of time, where the therapeutic team get to experience them over a long period of time, there's a lot that gets identified and it can be brought to their attention, and those necessary changes can be made. Thank you, Colin. Okay, and then the last one is number 10, skill development for sustained recovery. Sustained recovery from addiction requires more than just abstaining from substances. Spoke about that a little bit earlier, the difference between being clean and being in recovery. It demands a comprehensive set of skills to navigate life's challenges without resorting to old habits. Long-term addiction treatment is an optimal environment for skill development, empowering individuals to build a robust toolkit for lasting recovery. Therapeutic interventions offered during long-term treatment encompass an array of practical skills. These may include stress management techniques, communication skills, assertiveness training, and strategies for dealing with triggers and cravings. The extended duration of treatment allows individuals to not only learn these skills, but also practice and refine them in real-life scenarios. Moreover, as individuals progress through long-term treatment, they gain insights into the patterns of behavior that contribute to their addiction. Armed with this knowledge, they can develop healthier coping mechanisms and strategies for managing high-risk situations. By cultivating these skills over time, individuals enhance their ability to withstand challenges, make sound decisions, and maintain sobriety long after the treatment period concludes. Okay, so those are just some of the benefits of long-term treatment. So, in spite of this, we often still find that there is a resistance to long-term treatment. These points just maybe give us an indication as to why that is. So despite all the evidence, it is tough to convince some addicts and even some family members that 3 to 6 months of treatment offers the best chances of success. And this can be because people argue that they can't leave their jobs, their school, or their families for that long. And in some cases, it is valid, and that's why there's different forms of long-term treatment, and we'll have a look at what that entails. Also, the addict and the loved ones want to put the problem behind them as quickly as possible. It's painful, it hurts, we want to address it and we want it to be over and done with. So they want to believe it will be fixed up very quickly and they can go back to normal and not have to talk about it. We need to keep in mind that addiction is similar to any other chronic disease, such as heart disease or diabetes. It's unfortunately not going to go away. In terms of the attention, and therefore it also requires the same amount of attention and perseverance needed to remain healthy. Instead of viewing treatment as a sacrifice, one needs to remember that the individual will gain so much more than what they will lose. We have a slogan that we often say in treatment, and that is, whatever we put in front of our recovery, we will surely lose. It's important that we prioritize our recovery, and that comes first and foremost, and making sure that is strong and that is stable. Because if that's not strong and that's stable, this work that we're going back to, we're going to lose that if we end up relapsing. This family that we're wanting to go back to, we're going to lose that if we end up using. So anything we put in front of our recovery, we're going to lose it. Thank you, Calvin. So what does long-term treatment look like at Changes? We have the secondary care program, we have outpatient, aftercare, and living recovery. And while in the Changes system or part of our Changes family, patients can be assessed continuously by the multidisciplinary team to evaluate whether a patient can progress to a less intensive phase of treatment or whether a more intensive phase of treatment is perhaps required. So as we go through these different phases in our long-term treatment, you'll see that the intensity definitely goes down quite a few notches. Thank you, Calvin. Secondary care. So secondary care, River Manor, affectionately referred to as the farm, is the long-term treatment facility of Changes. River Manor offers a safe, structured, and caring environment where patients have the opportunity to process their addiction in depth. Again, secondary care takes place on an inpatient basis. So for that time period, the patient will be staying with us, residing with us. That is their home for that period of time. One of the main purposes of our secondary care facility is, again, to allow people to get past that initial critical 90-day mark. Secondary treatment, like primary treatment, is also individualized to each patient's individual needs. Following admission to River Manor, a comprehensive assessment is conducted, whereafter a treatment plan is formulated to suit each patient's individual needs. So that helps us to identify different areas that need to be addressed, different things that need to be worked on, and starts to give us an indication of perhaps how long one would require to be in treatment. Secondary care treatment addresses behaviors and underlying emotional problems, the beliefs and unhealthy habits that take the person back to active addiction. So there is a level of that takes place in primary care 100%, but a lot of the focus again on primary care is that denial and dismantling that denial. So when certain behaviors and beliefs get pointed out, that denial is still present. So it's often met with no, I don't struggle with that. No, it's not a problem. It's not an issue. And again, that's the beauty of time, is that eventually that denial starts to diminish. One acknowledges these flawed beliefs, these unhealthy habits, and therefore once they acknowledge it, there's time to change that. So it's also where a recovering person can practice the tools that they need to stay away from drugs or alcohol. So for instance, if boundaries is something that we have taught a patient, they have opportunities to practice that within the environment, with their peers, but also perhaps on phone calls with families. They actually have time to put those things into practice. And when there's some sort of kickback or struggles around it, then it's something, again, that can be processed in treatment. The aim of secondary care is to continue building on the positive gains made during primary treatment. So there are changes that take place. There's a lot of work, as we said. It's a very, very intense part of the process, primary care. So there's a lot of work that's been done. And when they come over to secondary care, it's a great foundation for the therapeutic team at secondary care to continue building on. Clients are encouraged to continue to identify what needs to change and how change can be implemented. So again, over time, the longer one has in treatment, the more things you become aware of that need to be addressed. They're also encouraged to examine feelings, attitudes, behaviors, and relationships to ascertain in what way these may be helpful or self-defeating. Patients are encouraged to modify self-defeating behaviors, strive for openness and honesty in all aspects of life, to improve relationships, handle negative feelings constructively, and to set realistic, attainable goals. Thank you, Calvin. Okay, so again, just a few points there, but it entails so much more. The treatment in a driven manner includes individual counseling, group therapy, psychoeducation, lectures and workshops, creative therapy, animal therapy, family involvement, including visitation every 2 weeks, written step work, community or peer support, and around-the-clock care and supervision. Next slide. Okay, the halfway house. So the main purpose of tertiary care or halfway house is to assist with reintegration after leaving an addiction treatment program. Tertiary treatment, like primary and secondary, is again tailored to each patient's individual needs. Tertiary care involves maintaining abstinence and initial treatment gains. The residence is designed to allow patients to return to more normal lives and routines while offering support and advice within a drug-free environment. Patients are encouraged to return to their employment or seek employment, or alternatively study while at the halfway house. Support is provided during this process. So just to get back to that reintegration process, so those intense phases of treatment have now gone over to a place where one needs to start reintegrating back into life, reintegrating back into family, perhaps go back, return to your work or start looking for work, maybe return to studies or start studying. So one can almost start with normal living again, but in one of our halfway houses. So it's a house where they get to stay, where meals get provided, they get to obviously sleep there, there's therapeutic support, all of this while they're continuing with life. So it just helps with that reintegration process. It's a little bit of a catch net or a safety net. Halfway house helps people maintain and reinforce sobriety by providing routine and structure and other services that promote a more fulfilling life. So there are routines. It's not as if the patients can sleep until 10 o'clock or 11 o'clock during the day. There's certain times that they need to get up. Everyone meets in the morning, does a JFT reading, and then goes their own ways, whether it's studying, whether it's going to work, whether it's doing some step work at the house. There are duties that everyone has within the house, keeping your space clean, etc. So there is a lot of structure and there is a lot of routine that also does create safety. Halfway house also allows the patients to build confidence in their ability to live a clean and fulfilling life. So they are still in a safe environment, but they're starting to do life and they're managing their recovery. Calvin, next slide. So while residing at halfway house, patients are also encouraged to connect to other sources of support, such as meetings and the fellowship. It's strongly encouraged in the halfway house. So they actually have a minimum requirement of meetings that they need to attend to. We encourage them to find a sponsor within a certain period of time, service positions, those 5 pillars that they've learned about while in primary care. The longer duration allows clients to build and strengthen their recovery. It also helps build healthy habits and routines that are integral to daily functioning. So what our halfway house offers is long-term sober living accommodation, assistance in finding meetings, ongoing support groups such as outpatients and aftercare, which we'll touch on next, ongoing individual counseling, regular check-ins. So because of that safety net, we can check if everything's okay, access to counseling in times of vulnerability or crisis, extended assistance in achieving a balanced and rewarding life. So reintegrating in a safe environment, finding their feet, and still doing recovery. Okay, so the next part of treatment, this is one that I said is not residential, so it is the outpatient treatment. Outpatients and aftercare and living recovery are almost 3 parts of treatment that follow on each other, and they definitely also go down in intensity. So they are very similar in a lot of ways, but I'm sure they will make a lot more sense once we start going through it. So outpatient treatment is a form of rehabilitation that allows patients to live at home or in another safe and therapeutic environment, such as a halfway house, while still working, studying, or reintegrating back into society. It is not as intense as inpatient treatment, but it is an effective yet flexible treatment option. Outpatient rehab programs entail a wide variety of therapeutic interventions and services, such as support while readjusting into society, individual counseling, group therapy, psychoeducation, and teaching recovery skills to help reduce relapse and promote long-term recovery. The benefits of outpatient treatment is that it is an option for people to keep working while still going through treatment. There's also a reduced cost, and there's less disruption to daily life. So again, they can continue working or studying, but they're still undergoing treatment. And in the next slide, I will explain what that looks like. Sorry. Thank you. So outpatient care changes entails group therapy, didactic training, and counseling, where patients are given the appropriate level of support as they face challenges of living a sober life. Issues that are often addressed in outpatients include recognizing triggers and managing them to prevent a return to use, reinforcement of coping mechanisms and skills learned. Again, they've learned it, they've started applying it, and it's just about reinforcing. Support in making healthy choices about lifestyle, activities, and relationships. Embracing a support network, sharing and relating on day-to-day struggles. So outpatient treatment at Changes takes place every Monday to Friday from 4:30 in the afternoon until 7 o'clock, and that takes place at our primary care facility in Northcliffe. So there at the bottom, you can see what that entails. So during those time slots, there are lectures, there's group therapy that takes place, and all of these points that we discussed above are topics that are often brought up in the outpatient treatment, and issues that can be dealt with. So it's very much a particular phase that people are in. So they're starting to reintegrate, they may be getting involved in relationships, or they're back home with their loved ones, and there's issues that are arising from that, and they have a safe place where they are able to talk about it, where they're able to learn about it. So yes, the outpatient includes lectures, group therapy, weekly counseling sessions, regular testing as required, access to counseling services, again, in case of an emergency. So each patient is assigned a counselor that they have these sessions with and that they are able to contact in the event of an emergency, as well as ongoing evaluation by the multidisciplinary team, again, to evaluate whether they need to step down, whether they can continue to a less intense phase, or maybe they're going through a bit of a difficult time. We need to take them back a phase of treatment. So it's a nice catch net or safety net to have. Thank you, Carlin. The next one is aftercare. So again, it has the same benefits as outpatient. That patient is able to reside at home or another safe facility and continue with everyday responsibilities while continuing with a less intensive phase of treatment. So where outpatient was Monday to Friday for 2.5 hours, the aftercare takes place virtually on Zoom 3 times a week for only an hour between 5 and 6. So again, you can see that intensity is definitely going down, a lot more responsibilities being handed over to the patient. The purpose of the group is to support each other in achieving and maintaining healthy behavior that is conducive to a life in recovery. In addition to the above, aftercare changes includes the following. It's group therapy. It also includes a weekly counseling session. So often the counselor that the patient had during the outpatient, they continue with them into the aftercare and they have a weekly counseling session with them. They also have access to the counselor or counseling services in case of an emergency. And there's the ongoing evaluation by the multidisciplinary team. The last phase is living recovery. So our living recovery program is for patients who are 9 months clean and sober. And that is very much progress dependent. So that is generally our benchmark, but perhaps if we feel that somebody still needs a more intense phase of treatment, they might remain in aftercare or outpatient for a period of time. So this weekly group session is held every Thursday from 5:30 until 6:30 and also takes place on Zoom. So again, outpatient 5 days a week for 2.5 hours, aftercare 3 days a week for 1 hour, and then living recovery, which is once a week for 1 hour. Weekly group therapy is focused on here and now issues and maintenance of the recovery lifestyle. So they've learned so much, they've unpacked so much, they've been doing this for 9 months. So it's just about that maintenance and perhaps processing and discussing issues that might arise. The Living Recovery Group assists in maintaining the coping skills that patients have learned during their process so that they can continue building a healthy and fulfilling life. Many people believe that recovery truly begins after rehabilitation, which is why it's so important that you receive the right support. We often say to our patients that the hard work starts when they leave the gates, and that's so true. They learn a lot, they're equipped with a lot, but it's about implementing those things that they've learned. Family involvement. So where do you as family members come in? Family members are encouraged to be involved in the treatment process and can aid in successful treatment outcomes in the following way. Firstly, by attending the weekly family support groups, and I put a little smiley face there because if you're hearing this, then you're here, which is great. Next one is engaging with your loved one, being involved in the therapeutic process, also participating in continuum of care discussions. So if those discussions come up, either from the therapeutic team or from your loved one, take part in those discussions and ask questions. If you have questions, ask as many questions as possible. The therapeutic team is really there to try and help and to guide. And then also, as we mentioned earlier in the presentation, it's about setting boundaries and discussing bottom lines with your loved ones. So what are you okay with and what are you not okay with? What would you like your loved one to be doing, and where do you see their treatment process going? It's very important for you to have your views and opinions on that and to discuss that with your loved one. So just in closing, there's a lot, but I think the main thing that I just want you guys to take away from this is that recovery treatment is a lengthy process, unfortunately. It takes time for both you and for your loved one to heal. So please speak to your loved one's therapeutic team about what options are available and what is in the best interest of your loved one. Again, it's very individual, so not everyone has to go through all of these phases of treatment. And that's something that your loved one's counselor or therapeutic team can definitely advise on. Remember that you are a valuable component in this treatment process. Yeah, so thank you to everyone for your time. Again, I know it's quite a lot to take in, but at this point in time, we're very close to the end. But if there are any questions or any comments.
Roxanne, we have a question here. Hi, a couple of questions. Is secondary care offered only to changes post-primary care individuals or open for admission to external patients as well? Is River Manor the RIMSIG facility? So maybe we'll just answer the first one.
The
Is
RAMP
secondary
facility.
care offered only to changes post-primary care?
Kate, I just,
Hi there. No, absolutely not. I mean, if somebody's gone through a significant detox program and a primary program and has a fair understanding of the 12-step program, absolutely we can move them into the secondary phase without questions. In addition, should they have done treatment a few times but need River Manor, but have had a relapse per se, we can do a detox at primary and then move immediately through to River Manor rather than sitting in one place. So again, it is an individualized program, and it's welcome for anyone who's had the basic primary intervention.
thank you. Yeah, so very much, I think that sometimes people have been through a treatment, or they've recently been through treatment, and maybe they're just going through a bit of a difficult time, and the family and even the patient themselves have come to a place where they think, okay, maybe I can benefit with a bit of extended time, and therefore it is an option for them to come into our secondary care facility, as well as our halfway house or even the outpatient option. All of those are an option for people, even though they haven't necessarily gone through our primary care program. Kevin, I think the second question was just, is the secondary care facility the one that's based in Ramsar? I think that was the question.
Yep.
Yeah, and that's correct. Our secondary care facility is based in Ramsar.
And then one more question after that. How do you observe and protect the sobriety of patients at a halfway house, given that they have exposure to the outside world and the tendency of addicts to be dishonest?
Okay, so that Kate, do you want to start?
No, go for it.
So again, individuals are assessed in terms of their readiness to go into the halfway house. So we feel that when the recommendation is made for the halfway house, that the patient will be able to abide to those rules and to those regulations. There is also management involved in monitoring their behaviors. There is regular drug testing that does get done at the halfway houses. Often patients are also involved in either the outpatient or the aftercare, where they also have access to the weekly counseling. So again, there are various safety nets that we do try and put in place to try and catch it. Sometimes it does happen. Unfortunately, that is the nature of addiction. But I'm speaking under correction, but I do think that we have quite a high success rate in our halfway house with patients not using in our halfway house.
And the reality is, if a relapse is going to happen, it's going to happen anywhere. Rather happen within the framework of a contained environment where there are emergency processes in place. So it is quite well monitored. It's well controlled in terms of trying to get people back into their new lifestyle and living with on life's terms, and it's got to happen somewhere along the line. And that's why a halfway house is not necessarily at the beginning of the process, it's more towards the end. You've understood the process, you know what you need to do, and you hold yourself accountable to those basic principles.
And I think the important thing to also remember around that is, in the ideal world, they would have been through some kind of 90 day treatment. And so their chances are looking a lot better at this point. And then, so how relapse then starts occurring is actually much, much slower. And the relapse process is much, much slower. And so it is actually a bit easier to observe when the relapse process is sort of unfolding by the time they get to halfway. Because there's so much more layers and protection involved up till that point if they've been in a longer term treatment. So really the crucial aspect of halfway house actually working is that they have a full primary care treatment and then some long-term treatment. Those are your best chances of halfway house really working. And I think, no, I'm not going to take too much time talking about that, but yeah.
Thank you, Kevin. Thank you, Kate. It doesn't look like there's any more questions in the comments section. Anyone that maybe wants to ask any questions before we close? Sorry, I am aware that we've gone a little bit over.
There is another question, Rox.
Oh, okay, fine.
So, Roxanne, coming Thursday,
yeah.
this is the question. Coming Thursday, a loved one left halfway house to come home. Is it advised to take a drug test, and how often?
So that might or might not be something that was addressed within the relapse contract. Opinions differ. My opinion is that it's something that should be done on a weekly basis, especially during the early stage, and that it should be something that is not always done on the same day at the same time. So it needs to be done randomly. Today it's done on Monday, tomorrow, next week it's done on Wednesday, the following week it's done on Monday, then again on a Tuesday. And there's no reason for your loved one to refuse to be tested. Testing is not about trust. So if you do say, here, you need to get tested, it's not, oh, don't you trust me? That's all out of the picture. It's just part of the maintenance.